Welcome back again to Dina, Mina show at Digital Health Days 2015. And right now we have Laura Almenberg, who is the Senior Design Consultant at Veryday, which is one of the leading design consultancy companies in the world. Welcome, Laura.
Thank you.
So we'd like to start asking you, the workshop that you had today was titled Design for Patient Autonomy. Could you just tell us a bit more about that?
Sure. Well, let's begin with why patient autonomy is important. So we know that there are a huge range of types of patients. There are people who want to be autonomous and who want to have control of their lives, but of course there are a huge range of people who are not or who rather have a different kind of experience with healthcare. They want to be guided through, so to speak. But we know that those who are, because the system is designed for guiding people through the healthcare system, we spend a lot of money basically hand-holding people who don't need to be handheld in all cases. So what we are seeing is that there are these instances where people are excited and motivated to take control of their health. And the challenge is that the system makes that really hard. So design for patients to be autonomous, to have choice, freedom, independence in their health care. It means that we need to start thinking about how we give them the information and the tools and the data to be able to make those choices. So we believe that the future really is about how, well, of course we will have a more supported care system for others. We really need to start designing for people to take control of their own lives so that we actually save money in the future. And so the workshop itself was about challenging ourselves to think about how that applies in organizations.
And we also must ask you, Veryday is one of the leading design agencies, and you operate in so many market segments. What is interesting for us to hear, what special challenges you face when you create solutions, products, provide services in healthcare? What is different?
The healthcare sector for us has been, I think, a core part of our business from 1969. We've been, from the very beginning, thinking about how we can provide inclusivity and universal design to make products and services around health more accessible to people. And I think that part of what has made this company successful is that it has taken that position from the beginning. And I think that when companies come to us for healthcare, they're looking for that too. How do we make healthcare more accessible and meaningful and relevant to their own businesses? Yes.
So basically you use experience from other segments and from other market verticals in order to accelerate healthcare applications as well.
We certainly do. And I'd say the learnings, especially these days, because the patient's expectations, HCP's expectations are changing because of their experience in the consumer space, has a huge impact on how we interact and the kinds of solutions we're trying to develop now with our clients. But of course, this is the major challenge. That we have a shifting patient population, a shifting healthcare population who wants to do things in more interesting, fun, digital ways, and we come up against the challenges of, well, the regulatory, governmental challenges, of course. These are always the issue, but I would say one interesting thing is that I think we spend a lot of time talking about that. But we actually are the ones who have the ability to do something about that through lobbying and creating, or really pursuing the right players to get them involved and make changes in law or regulation. However, I think the more interesting thing is that we've really not focused on those who are implementing healthcare. And the challenge we have there is actually getting buy-in and participation and empowering those folks who actually currently work in a very different way, have been educated in a different way, have different even personal and personalities, ways of working, that are the new tools we're creating have a big, there's a big interaction or play between them.
So basically, to summarize, bringing expertise from other market segments, pay attention to completely changing patient landscape in terms of their preferences, and also taking into account regulatory. So those are the tricks and challenges.
Yeah, sure.
Yeah. Well, we'd like to thank you for coming here today, and we hope you enjoy Digital Health Days.
I've always.
Yeah. And hope to see you again next year. Thanks a lot.
Thank you.
Cheers.
Thank you.
So stay tuned for more interviews with more interesting people on Digital Health Days.